Hi, my name is Megan Tarvis, and I will be presenting my flashcard on herpes simplex. So, herpes simplex is a virus that contains human pathogens, which can be transmitted by direct contact through individuals. This can be either through the skin, mucous membranes, saliva, vaginal secretions, urethral secretions, semen. The virus can be either asymptomatic, symptomatic, or even leads to life-threatening conditions. Today I'm going to talk about two types. There are several different types, but type 1 is usually occurs with a younger generation through the saliva, occurs around the mouth, creating cold sores, and type 2 is transmitted sexually, creating genital warts. So the pathophysiology of herpes is when the virus enters the epithelial cells of the body through the mucous membrane, saliva, urethral secretions, vaginal secretions, or even the skin. Latency occurs within the peripheral nervous system, making the virus asymptomatic at first. HSV can stay asymptomatic, stay latent through their latent stage, through the neurons of the trigeminal nerve, and they can also be reactivated due to different exposures. This can include infection, stresses in the body, any damage or infection to the skin. The HSV virus can go back up to the surface and creating those vesicles that you see. The etiology is unknown how cells can remain in the neurons, but not in the rest of the cells of the body. The reoccurrence of reactivations of type 1 and type 2 are more at risk for future complications of the body. Virus is transporting through the peripheral neurons. They can enter different regions of the body, organs, such as the cornea of your eyes. Risk factors include, for type 1, type 2, any direct contact, like I said, with the skin or mucous membranes. If an individual has an active virus, it can be transmitted easily through oral sex, unprotected sex, and saliva, kissing. Infants are also at risk for HSV infections if the mother has an active HSV virus within her cervix, and she decides to have a vaginal birth. If she has an active virus, she should be having a C-section. If she decides to have a vaginal birth with the active virus, it can be transmitted through the vaginal secretions. The neonate can develop the skin blisters, and now they're at risk for encephalitis, as well as death if not treated, and other neural complications. Other individuals who are more susceptible, individuals with low immune systems who are immunosuppressed, they can be at risk for encephalitis as well. Signs and symptoms are pretty clear. For type 1, you're going to see the cold sore on the lip. It's very painful and tingling before it occurs, and then once it occurs, it's this blister that's filled with fluid. Once it erupts, it can form a crust on the surface. This is also with genital herpes as well. It's those vesicle-like appearances, and they're very blister-like formed. Another thing with type 2 is that they can develop more systemic response to the virus, fever, body aches, headaches, malaise. And once the crust occurs, appearance-like occurs, it starts to heal and becomes latent again. Diagnostic testing is pretty explanatory for this disease. It can be tested in different ways, nasopharyngeal, oropharyngeal, so through the mouth, swabs, skin swabs, can also be vaginal swabs or urethral discharge. Cerebral spinal fluid as well for HSV, as HSV travels to the peripheral system, they could be testing the spinal fluid, especially for those who end up with encephalitis. They can rule out herpes. Vesicles are swabbed. I work at a woman's ED, and I've had patients where we would swab the site, just the surface. Sometimes you can aspirate if the vesicles are formed, you can aspirate the fluid and send that off to the lab. If not, you can just swab it with a swab and send that to the lab. And usually get results in 3 to 5 days. And blood tests are more accurate, as obviously they can be diagnosed with having positive antibodies for HS1 or HS2. And that is my flashcard. Thank you for watching.